Death has this great cloud of fear, and I'm learning every day on how to deal with fear, and it's in preparedness. And I think today helps accentuate that point about being prepared when you deal with these type of decisions and thoughts. My question is guided around the fact that when you have all these physicians that are involved, who's making that call, and based on what different pieces of information? Is it the brain wave? Is it heartbeat? Is it the breathing? Is it blood? I mean, you know, where is that point of where the patient's not coming back? And who's making that? Who's helping us understand that call?
Repeat the question.
The question, as I understand it then, is how do we know when a patient is terminally ill? How do we know when a patient will no longer benefit from life support? All those kinds of things. The decisions are based nowadays largely on what is one of the virtues of the data age. We have information. We know how long most patients who have this problem survive with treatment, without treatment. We know what stage of things for blood pressure, heartbeat, and things like that have reached a point where recovery rarely, if ever, occurs. It's worth noting that a good deal of what we do is the balancing of benefit and burden. It's not an absolute yes or no, as much as it is saying, okay, this treatment can get you X more hours, days, weeks, months, years, but in so doing, this is the financial cost to you, this is the symptom cost to you, this is the mobility cost to you, and to say to the patient, is that worth it to you? We are the experts on what it can do for you and on what it can do to you. But the expert on whether it's worth it is the patient. And so there's a fair amount of that goes into the decision making as well.
I find the best way to make that decision is to have this conversation about what a person's goals are. When someone's diagnosed with something really difficult, one of the questions that should be asked right up front is, what are your goals for the next 6 months, the next 8 months, the next year? Those numbers are based on knowledge of the treating team about exactly what this means in terms of timing. And so we factor that into our conversations with you, with your loved ones, about what do you want to accomplish? I'd like to see my children graduate from high school. Okay, here's what we have to do to get from here to there, and here are the consequences. And so sometimes I think that helps sort of frame what can we do, what can't we do. I think we're obligated to tell you which things work and which things don't, and what that means, and to connect back to your question about euthanasia, to talk about what's okay and what's not okay, and what other people have tried and not tried, when it's okay to say no, when it's not, those kinds of things. We try, even at end-of-life care, especially at end-of-life care, to use evidence, evidence-based medicine about what works, what doesn't, what extends life, what prolongs suffering. All of those factor into the conversations that you hear. The best way that works is a shared decision-making, where the family and the patient ask questions, prompting the doctor to think about everything he or she knows about this illness, what the last 100 patients they saw looked like, what new things are out there in their literature to help guide decisions.